Okay, today we are going to talk about facial nerve core concepts, right? Facial nerve core concepts, right? Now you must be knowing that facial nerve is a master of facial expressions, right? It regulates, controls the muscles of facial expression, everyone knows. And it is so much master on facial expression and emotions that if you are very sad, facial nerve helps you to bring tears. And when you are angry, it helps you to produce a lot of saliva, you can throw it on others. Yeah, right? So let's start how it really works, right? First we will see that what kind of fibers are present in facial nerve. What type of fibers are present in facial nerve. It means we have to go back in the central nervous system. That in the central nervous system, right, facial nerve is taking what kind of fibers and it is connected to what type of different nuclei, right? So let's draw brain stem. Here is your suppose midbrain, and here is pons, and here is medulla, right? And your beloved spinal cord, cerebellum. Now, number one, facial nerve have fibers, motor fibers. First I will talk about the motor fibers and then I will talk about sensory fibers. Facial nerve have motor fibers which mainly control the muscles of facial expression, right? They are called Branchiomotor fibers. You must be knowing that muscles of facial expression are derived from the second branchial arch, right? And those fibers of facial nerve which are connected with the muscles of facial expression, they are called branchiomotor fibers, right? Now these fibers have their cell bodies in the lower part of the pons, right? In the lower part of the pons, there are a group of cell bodies here which make a nucleus. We call it facial nerve proper nucleus, right? The group of cell bodies here in the lower part of pons or rostral pons, right? And this group of cell bodies make a small nucleus, and this nucleus is called principal nucleus of facial nerve or facial nerve proper nucleus or branchiomotor nucleus of the facial nerve, right? And usually motor fibers from central nervous system, they exit forward. But there is something funny about these fibers. You know what happened? Rather than they directly move forward and outward, first they go backward. Anyone can tell me why they are going backward? Actually they heard something that there is a tent here on the back. You know what is this tent? Can you tell me what is this tent? Fourth ventricle. And I think these fibers heard somewhere that there is some sex going on here. So they start moving backward. But by the time they reach here, they were very sad. You know why they were very sad? They came to know that was not sex, that was six. Six nerve nucleus is here. They misheard it. So when they realize their mistake, they just move around this, what is this nerve nucleus? And go to their normal route. Have you seen men? The naughty men, when they are supposed to go forward straight, sometimes they hear there's something good there and they go back, but rather than sex they found the six, and when they found the six, they just turn back and go to the real destination. Is that right? Now, these facial nerve fibers, when they move backward and loop around the sixth nerve nucleus, they produce a little elevation, yes, a little elevation in the floor of fourth ventricle. This is called facial colliculus. What is it called? Facial colliculus. And then they turn forward and downward and they exit here. What is this place where they are exiting? Right? It is ponto-medullary junction. But on the side, there is cerebellum. Because cerebellum is on this side, you are getting it. So we also call it Ponto-Cerebellar junction. You are understanding? So that is the point, Ponto-Cerebellar junction, where facial nerve is exiting outward. Let's see a frontal view, right? Let me draw midbrain from the front and brain stem. This is the brain stem from the front, right? Pons, medulla. And what is on the side? Yes? Cerebellum. Thank you for knowing. And sixth nerve come out here, right? Seventh nerve is exiting at this point. Seventh and seventh, right? And of course, just lateral to the seventh, which nerve is coming out? Eighth. Vestibulo-cochlear. You are getting it? At ponto-medullary junction, as you move from medial to lateral, the nerves which are coming out there, or they are attached at this junction, that is 6th, 7th and 8th. Abducent, facial and vestibulo-cochlear. Is that right? But especially because 7th and 8th are much laterally placed, so we can also say that they are exiting at ponto-cerebellar junction. Right? So these facial nerve fiber, which are going to be connected eventually with the, mainly with the muscles of facial expression, right? They are coming out from here and they make the facial nerve proper. This is one group of fiber. Then there's another type of motor fibers which come out of the brain stem and become part of the facial nerve, right? This everyone knows. The facial nerve has fibers for the muscle of facial expression, but facial nerve has more fibers, right? Now, second group of motor fibers which are coming for the facial nerve, right? Those motor fibers are basically parasympathetic fibers, and those parasympathetic fibers help you to lacrimate and salivate. Is that right? Now, those parasympathetic fibers which are part of the facial nerve, and eventually they supply the lacrimal gland and which salivary gland? Submandibular and sublingual salivary gland. Is that right? They are connected to which nucleus in the brain stem? Anyone? What? My question is, listen, my question is, facial nerve has parasympathetic fibers, right? Facial nerve has parasympathetic fiber. My question is, in the central nervous system, in the brain stem, these fibers are coming from which parasympathetic nucleus? Yes, anyone? What happened? You don't want to tell me anything? Okay, you like to hide your knowledge. Yes, you are reading the book. Can you tell me? Still you couldn't find it. Okay, let me tell you. There's a nucleus here. Look, this is also lower part of the pons, you can say. Right? This nucleus is parasympathetic nucleus, right? Here it has, this is weeping nucleus and drooling nucleus. This nucleus is called superior salivatory nucleus. What is it called? Superior salivatory nucleus. But actually it should be called lacrimatory salivatory nucleus, right? But I don't know why. So in some books they write just lacrimatory nucleus, and in some books they write just superior salivatory nucleus. But you must remember, this nucleus has the neurons, cell bodies of the neurons, which are sending the fibers, right, which actually eventually are going to influence the lacrimation and salivation by which glands? Sublingual and submandibular, right? So this is superior salivatory nucleus and rostral part of pons, in the lower part of pons you can say, and this is having cell bodies of preganglionic parasympathetic fibers. Preganglionic parasympathetic fibers, and these fibers, they come out of these, what is this? This parasympathetic fiber come out, right, and they also go with the facial nerve. Superior salivatory nucleus, right? Remember, inferior salivatory nucleus is just below it, and inferior salivatory nucleus gives this fiber to which nerve? Ninth nerve, glossopharyngeal, right? But superior salivatory nucleus gives fiber to seventh nerve, and superior salivatory is not only salivatory, but it is also lacrimatory. Is that right? Now these are the two motor type of fibers which are component of facial nerve. Now we come to the sensory fibers with the facial nerve, right? What kind of sensory fibers are present in facial nerve? Yes, my friend.
It gives the sensation of the tip of the tongue.
Oh my God, he really is a sexy boy. He is saying that facial nerve has some sensation from the tip of the tongue. What kind of sensation? It's really not from the tip of the tongue. It is anterior 2/3 of the tongue, right? I know at your age you are very bothered about the tip, but I understand your preoccupation. But facial nerve is little more practical, right? You know, here is your tongue. What is the color of your tongue? Black or red? Okay, some people do have black tongue, I think. Anyway, so this is the tongue, anterior 2/3 and posterior 1/3. Is that right? Facial nerve have sensation, collect the sensation from anterior 2/3 of the tongue. Which sensations?
Sour.
Taste sensation. Don't try to be sour, sweet. Just say taste sensation, right? Facial nerve through lingual nerve, which we'll go into detail, but the taste sensation from anterior 2/3 of the tongue is the taste sensation from anterior 2/3 of the tongue. Remember, touch, pain, and temperature sensation from anterior 2/3 of the tongue are part of the trigeminal system through the lingual nerve, right? But anterior 2/3 of the tongue, taste sensations, right? They pass through the facial nerve, right? And posterior 1/3 of the tongue, taste sensation go by which nerve? Glossopharyngeal. And this is facial. And posterior most, and from the, you can say, area around the epiglottis, taste sensations go by 10th nerve. Is that right? So my friend, these sensations are not only at the tip. Fine? So anterior 2/3 of the tongue has taste sensations which are taken by facial nerve. So we can say, I will teach you later how these fibers really reach there, right? But just right now we say these are fibers for the taste, okay? What are these fibers? Taste fiber, right? Gustatory fiber, sensory fibers, right? They are connected, of course they are bringing the taste sensation from the periphery to the center, right? In the central nervous system, these fibers are connected where? Which nucleus in the central nervous system is related with the taste? What happened? Someone put your mute button? Any nucleus in central nervous system where all the taste sensation come? You heard of that nucleus, right? I'm going to make that nucleus here. Right? It is dancing a lot because it can taste sensation come here. What is this nucleus? Nucleus of Tractus solitarius. Nucleus of Tractus solitarius has many connections. Some of the very important connections are for the taste, right? And of course, because seventh nerve, facial nerve, collect that taste sensation from anterior 2/3 of the tongue. Is that right? So seventh nerve should be connected with which nucleus? Nucleus of Tractus solitarius, right? So these are seventh nerve fiber which will be connected with the, yes? Oh, thank you for knowing it. Right? So this is connected with Tractus solitarius. Let me tell you a little thing about Tractus solitarius. Tractus solitarius is, you know, nucleus for the taste. It means all the nerves which bring the taste fibers, they should have connection with which nucleus? Tractus solitarius. All the nerves which bring the taste fiber from the tongue, right? Right? all the nerves which bring the taste fiber from the tongue eventually should be connected to which nucleus? It's all logical. So gustatory fiber or taste fiber of 7th, gustatory fiber from posterior 1/3 of the tongue, and gustatory fiber from the 10th nucleus, all of them centrally end up on nucleus of tractus solitarius. Is that right? So anyway, I have shown here, this is the connection of which nerve? 7th nerve. Tractus solitarius nucleus takes some other sensations also. I will not right now talk about that. So this is how many? 2 motor fibers, part of facial nerve, and 1 sensory fiber. There is one more sensation which are part of the facial nerve. Who will tell me? One more sensation. Anyone? Facial nerve has touch, pain and temperature fibers which are called general somatic afferents, just to put a little academic situation. Touch, pain and temperature fibers are also in facial nerve, few fiber which are coming from the ear, right? Posterior part of, what is this? External auditory meatus and external ear, right? So those are which fiber? Touch, pain and temperature. What are these fibers? Touch, pain and temperature. They are also part of facial nerve. And these touch, pain and temperature fibers, when they go into central nervous system, of course, they cannot be connected to motor nuclei, and they are not connected with the nucleus for the taste. They are connected with the major nuclear system in the brainstem, which is connected with all those nerves which are concerned with touch, pain and temperature on face. Which is the major nuclear system for touch, pain and temperature? Trigeminal system. Have you heard of trigeminal system? Right? Trigeminal system. So you can say here is mesencephalic nucleus of trigeminal, and here is pontine nucleus of trigeminal. Have you heard of it? And then there is another trigeminal nucleus. What is this? Oh my God. This is not he is saying corticospinal. It is not extending from cortex to spinal cord. Oh my God. You are adding to my knowledge. It is called only spinal nucleus of trigeminal, right? Actually, listen. Mesencephalic nucleus of trigeminal, pontine nucleus of trigeminal, and spinal nucleus of trigeminal, all 3 nuclei collect the touch, pain, temperature from face, right? Because most of the touch, pain, temperature sensation go through the trigeminal nerve, and trigeminal nerve is heavily connected with these nuclei, so this nuclear system is called trigeminal nuclei. But now we know that even some little touch, pain, temperature sensation or somatic sensation, some of the somatic sensation may go through 7th nerve, 9th nerve, 10th nerve. But because of touch, pain, temperature sensation, they have to go to the nuclear system which is related with touch, pain and temperature. And what is the nuclear system for touch, pain and temperature? Trigeminal nuclear system. So if I say 7th nerve has fibers for touch, pain and temperature or somatic afferents from the external ear, when they enter into central nervous system, they should be eventually connected to, yes, what is this? Mesencephalic nucleus. Sorry, spinal nucleus of trigeminal. So these are the 4 main fibers in facial nerve, right? So first of all, what we have learned up to now, the facial nerve has, importantly, clinically, there are 4 types of fibers which are present in facial nerve. Number 1, branchiomotor fiber, which are going for muscle the facial expression mainly, right? Then there are parasympathetic fibers, which are mainly concerned with lacrimation and salivation. Then there are taste fibers with anterior 2/3 of the tongue. And then there are touch, pain, temperature or somatic afferent which are with external ear, right? But as you should know, these fibers are connected in periphery, where you should also know how they are connected in centrally, right? So branchiomotor fibers in the periphery, they are connected with muscle the facial expression, and centrally they are connected with principal nucleus of facial nerve, branchiomotor nucleus. Parasympathetic fibers, peripherally they are connected with the lacrimal gland and also with the submandibular and sublingual gland, eventually they are controlling their secretion. Centrally superior salivatory nucleus. Taste fiber in the 7th nerve. Peripherally they are connected with the anterior 2/3 of the tongue for the taste. Centrally they are connected with rectus solitarius. Touch pain temperature, somatic afferent of the facial nerve. Peripherally they are innervating external layer. Centrally they are connected with the trigeminal nuclear system, spinal component. Am I clear? Now, once all these fibers exit, these fibers make two bundles. They are arranged into two bundles. All these three fibers, they are part of one bundle. They are part of one bundle, right? They become component of, they make a one tight bundle, right? In this way, facial nerve is divided into two parts. One part has mainly branchiomotor fibers, and other part has parasympathetic fibers as well as taste fiber as well as somatic afferents, right? This component of the facial nerve is called nervus intermedius. What is this component called? Nervus intermedius. Now, this nervus intermedius, in most of the book as it is written, it is the sensory component of facial nerve. And this is called facial nerve proper, which is also called motor component, right? These branchiomotor fibers, right, they make a thick bundle, and this is called facial nerve proper. This is facial nerve proper, right? And this is nervus intermediate. Even though usually we say conventionally that nervus intermedius is sensory component. Of course, it's having taste sensation and also touch pain temperature sensation. But we should not forget that even though we call it sensory, but it also has parasympathetic motor fiber. Is that right? Clear? Now, we know these are the fibers which are component of facial nerve. Now, next work is that we have to see how these fibers reach to their final destination. Because right now these fibers, when they exit out of the brainstem at Ponto-Cerebellar junction, they are inside the cranial cavity, right? We have to see from this point on, right, how they reach to the final destination. For that purpose, I will draw first some landmark of head and neck, some landmark features of head and neck, then we'll see how facial nerve and branches move about inside that system, right? So let's make it some landmark of head and neck. Okay, so let's suppose it is anterior cranial fossa, right? Of course, this must be orbit. This is anterior cranial fossa. Here it is middle cranial fossa, and here it is, yes, this is posterior cranial fossa. Is that right? Here it is what? Anterior cranial fossa. And of course, there's no fun in telling that under the orbit, what is this? Maxilla. If you forget, you can touch on your own face and know it. Under the orbit, there is maxilla, right? So I will just draw some important structure so we can see. And under the maxilla, of course, if you open your mouth, you will see your tongue. I think someone else will see your tongue, right? Here is your tongue. Yes. So anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Here it is brainstem, right? And this is orbit. Of course, there's no fun in telling there's something like this here, you know. And yes, anyone tell me what is this area? If you move on the orbit backward, under the orbit and on the back of the maxilla upward, what is this area called? I'm about to be impressed by someone. What is this area called? You have heard it so many times. You move on the orbit backward and maxilla backward and upward, and deep inside, right, there is a fossa here. All of you know that fossa. You have heard of it, but you don't want to tell me. I know you are nasty guys. Pterygopalatine fossa. Why don't you tell me? Have you heard of pterygopalatine fossa? My friend, if you don't know where it is, how about? Oh, very sad. What is this? At least now you tell me. What is this? Pterygopalatine fossa. Right, anyway, this says something very important related with the facial nerve. So we will talk about that, right? Then, there is another very important landmark related with the facial nerve here, and that is, what is this? This is middle ear. I want to show you relationship of facial nerve with the middle ear. Now, let me make the middle ear exactly more clearly. I'm going to draw the middle ear here and related with the external ear also. Let's suppose this is external, middle ear is something like a cube. This is middle ear cavity. I'm drawing the structure on the right side. And if you move on this side, of course, then what is it? Ear, and this is maybe of a lady. This is external ear. From external ear, if you move, external auditory meatus, is that right? From external auditory meatus, what is this wall? Yes, very good, tympanic membrane. You get it? This is the lateral wall of middle ear. This is lateral wall. And what is this wall? Interior wall. What is this? Roof of middle ear. This is the roof of middle ear. This is interior wall of middle ear, directed forward. This is the roof, and this is lateral wall of middle ear. Am I right? You are clear about this? This is the right ear. Okay? Now, it's very important to understand the very intimate relationship of facial nerve with the ear. Right? Because many clinical problems occur